We have an event on our hands in Butte-Silver Bow in Montana and our country that is undeniable. And today is about us relaying to you additional measures that we'll be taking in Butte-Silver Bow to try to stem the direction of our numbers. We are awaiting to learn from various newly elected officials the COVID philosophy that will be laid out. And I was very pleased to speak with Governor-elect Gianforte yesterday, who will be making efforts to formulate an advisory board to advise him on new COVID policies. So I'm very gratified to hear that and to know that within government transition, we'll move forward with our COVID efforts even after the first of the year. I want to relate to you that the Butte-Silver Bow Health Department, one of our core values is science. We're driven by evidence. And we compile data until the cows come home. That data really drives us in our decision making. The things we look at are things like positivity rate, how many people test positive in any given time in Butte-Silver Bow. And the last measurement we had for that was 19.6%, meaning that almost 1 in 5 people who are testing in Butte are being determined as positive. This morning, before noon, Butte-Silver Bow received 33 newly formed cases, and we know we'll have more this afternoon. We have been inching to 30 cases every day, and now we're over 30, and it's likely that we could have around 60 cases today newly confirmed. That's not good. I regret to inform you that we have had our 13th and 14th fatality in Butte-Silver Bow. They are legacy residents of ours, and they come from the Copper Ridge facility, long-term care facility here in Butte. As you know, another long-term care facility, Continental Care and Rehab, is the home to 12 fatalities thus far. Our hearts and sympathy are with the families of those residents and with the staff and residents of Copper Ridge and Continental Care. When we last measured, we estimated that 84 cases were occurring in Butte per 100,000 population. And it's an important metric because it gives us a per capita look at what is happening. That measurement, 84 cases per 100,000 population, puts us ahead of Yellowstone, Missoula, Lewis and Clark, and Deer Lodge counties. Any incidence rate of more than 25 per 100,000 population puts us into a red zone risk level as determined by the Harvard Global Health Institute. So anything over 25 is red, we're at 87. I would like to announce what our new measures will be. We're calling it the Flatten the Curve effort. Our goal is to decrease our COVID-19 incident rate to 25 cases per 100,000. Again, we're at 84. And we would like to move our positivity rate to below 10. That is our goal. So the purposes above and beyond that, we want to prevent uncontrollable spread. We want to keep our schools and our campuses open. We want our hospital to be healthy and to continue excellent quality care. We want to protect our high-risk populations, which include our legacy residents, and we want to protect essential services. Therefore, effective at 10 o'clock tomorrow at 8 a.m., we will limit business capacity to 50%. We're currently at 75%. Currently, anything over 50 people in regard to an activity or group gathering needs to be reviewed by the health department. We're moving that to 25 people. We will have alcohol service at bars, casinos, distilleries, and other like establishments to stop at 10 p.m. We're currently at 12:30 p.m. And we're asking out of the bottom of our hearts, this is not an order, but we're asking you to stay at home. If you have to go to work, we get it. If you have to get groceries, we get it. But we're asking this community in an advisory sort of way to please stay home. We will reassess all of this on December 1 and then weekly thereafter. If our goal is met, 25 cases per 100,000 and a positivity rate of below 10, we will look at loosening and lifting the restrictions. If our goals are not met, we will maintain our restrictions. If we're on fire, quite frankly, we'll look at tightening our restrictions.